Hello, my name's Dr. March and I'm a dentist and I want to help you have a better understanding of the importance of proper oral hygiene. So I created this slide to help you um, be a little bit more educated. I get a lot of questions from patients and friends that ask about, you know, whether it's important to floss or what kind of mouth rinse should I use or what's the best way to keep my mouth clean. And so I've decided to create this video to share with people so that they can have a little bit more clarity. I want to start with brushing technique. So I get patients coming into my office sometimes and I ask them, how often do you brush? And they say every day, most of the time. And I look in their mouth and I see plaque everywhere. And it's not just a little bit of plaque, it's been built up for days to weeks. And so I talk to them and I say, well, maybe we could work a little bit on your brushing technique because they need to be a little bit more effective. And so I get to talk to them about how to brush and brush more effectively to get rid of plaque. So you want to have a really good toothbrush. I recommend everybody get an electric toothbrush instead of a manual toothbrush like you see here on the screen. Electric toothbrushes do a really good job cleaning teeth, and it's easier. You don't have to push so hard, and it does a really thorough job. I've noticed a remarkable difference since I switched over to an electric toothbrush. People say, how often should I change my toothbrush? Well, and my answer is it depends. Look at the bristles on your toothbrush. Are they doing what they're supposed to do? And if you see, if your toothbrush has bristles that are just bent and hanging over the side like that, you're due for a new toothbrush. Okay, they should be nice and straight like this. That way, they're a little bit more effective at brushing your teeth. Sometimes they put these little rubbery, I don't even know what they call them. These rubbery bristles on the side of the toothbrush. They're doing that to try to just get the plaque off of the gums. A lot of times plaque it settles onto the gum where the tooth and the gum meet, and that is an area that you really need to focus on. So I suggest to people that make sure when you're brushing, half of the bristles on that toothbrush are on gums and half are on the tooth. Now, of course, you should brush every surface of every tooth. You should clean every surface of every tooth, but you really need to emphasize getting half of the bristles on gum and half on tooth. Here's an example of plaque. I do this on patients a lot. I just go in, I scoop plaque off their teeth. I try to show them, hey, there's plaque right here. You can be a little bit more effective in your brushing. That's because they're maybe brushing up here and doing half the tooth and up and getting these parts, but they're not getting the parts down here. So please make sure you're brushing half on gum, half on tooth. You can see on this patient, the gums are nice and pink here, but when you get here, they start to really redden up, and that's a sign of irritation and gingivitis due to this plaque. So this lady right here with this picture, it makes for a nice picture, but as far as teaching technique, that's a poor technique if you're going to have your toothbrush right there on the tooth. It really needs to be up here along the gum line. You really need to massage and brush and get that plaque off. Otherwise, you're going to have some problems. Okay, flossing. Flossing is very important for cleaning between the teeth. Now, when you brush, you can brush the sides, and you can brush the biting surface, and you can brush, the tongue side and the cheek side of the tooth. But you can't really brush very well between the teeth because they're tight and they're filled with gums. And so when you floss, you slide that floss right through the contact, because we have colonies of bacteria that are just sitting right there at the contact. It's a tight space. It's easy for them to form a colony and stick to it. And when we get cavities at the contacts or slightly below the contacts in a lot of cases. And so look at this tooth right here. See this cavity where it's black? It goes in and then it mushrooms out like that. That's a cavity because this colony of bacteria didn't get broken up by floss. So brushing or flossing is very important to help prevent cavities and get that plaque off so it just doesn't build up and create problems. The cavity goes out right here too. There's a small cavity right there. You see that little triangle of black? Small cavity into the enamel. So you just make sure you're flossing every day. Okay, to clean between the teeth. When you floss, you are going to get down into this gummy area. This gummy area is really hard for flossing. Like, floss is not very effective. It can break a contact really well, but when it gets down in here, it's got this huge space, and floss has such a small cross section. It's really small, so it's very ineffective at cleaning down here. So what happens is you might floss, but you're going to get buildup on your teeth here because plaque's not getting removed. What you see here in these circles are these little pointy things. That's called calculus, and that's what happens when plaque has been sitting on your teeth long enough. It actually calcifies and binds itself to the tooth and becomes a hotel for bacteria. And bacteria start hanging out down here between your gums, and it causes your gums to get red and swollen. They bleed easily. It can cause bad breath. But the biggest thing is it'll dissolve your bone. And so that environment will dissolve your bone. That's called periodontal disease, and you don't want that. It's not something that's nice. So to get rid of this, you're not going to be able to brush or floss this off once you get calculus. It has to be scraped off with a tool. That's why you come in and get a cleaning from the hygienist. The hygienist can get your gums numb so you don't feel it, you're comfortable. They go under there and scrape that calculus off so it won't come back. Hopefully, with proper home care, with these things right here on the left. These things here on the left are called proxy brushes or interdental brushes, or they got different names. You find a brand that you like and go for it. But they have different diameters for different size teeth. I, for myself, usually use 2 sizes because one size is either too big or too small, so I use 2 of them, and that can usually clean my teeth really well. There's been a lot of times where I'm flossing and I'm getting down in the gummy area, and then I go back after I'm done flossing and I'm using these brushes and I'm reaming them in and out. That's what you're supposed to do, and I'm still pushing out food after I floss. So it's very important that you get rid of everything between your teeth with these brushes, and I can't emphasize how awesome these things are. People use water picks. Water picks are okay. I kind of like the mechanical rubbing that happens with these proxy brushes. I feel like I'm getting a better cleaning. But if you have a water pick, that's good too. But try some proxy brushes if you're having some areas that just kind of give you some problems. And then you can get in there and mechanically clean it. And then mouth rinses. I really love mouth rinse that has fluoride in it. Fluoride's great in low doses. People are afraid of it sometimes because they've heard things that it's poisonous and they can kill you. And in large doses, that's probably true. Just like Clorox, that's a poison, right? You're not supposed to go drink Clorox or do much of that, but we put it in our pool, we put it in our water in small doses. It's a miracle. Same with fluoride. Fluoride's awesome, and it's a miracle in a lot of ways because what it does is fluoride goes into the tooth. It soaks into the tooth, and the tooth is able to soak it in, and it changes the structure of the tooth. I believe it's calcium that comes out and is replaced with fluoride, and fluoride has a stronger bond, and it makes the tooth more resistant to cavities. And especially if you're like getting older and your gums are receding, and so your roots are starting to get exposed. Roots are really thin. They have a thin covering on them called cementum. And cementum if it scrapes, it can be really hot and cold sensitive. If it gets scrapes, it's really prone to cavities because it's receding and it's thin. So you really want to strengthen all your roots, your receding lines, your teeth, your enamel with fluoride. Hydrogen peroxide is also a good thing to rinse with too if you want to kill some bacteria. If you look, I tell people this and they're like, hydrogen peroxide, I didn't know that. Yeah, if you look right here on the bottle, for use as a gargle or rinse is what it says right there. Yeah, so you can rinse with that. It tastes terrible, but it does a good job. And then if you're desperate, I like to joke with patients and I tell them, well, you should probably try swishing with some holy water. See if it helps. I don't mean to offend anybody, but I think it's funny. So fluoride is really good. And holy water. This is what you want your teeth to look like. You want it to look nice and pink. Look in your mouth. If you see any areas that are red like this, kind of beet red or get swollen, you really need to do a better job cleaning. If you open your mouth and you look on the tongue side of your lower teeth and you see something like this, you're overdue. This is buildup in calculus. So you need to get those cleaned up. Otherwise, that's going to lead to a lot of bone loss and gum infection. So anyways, I hope this helps. If you have any questions, reach out to me or leave a comment below, and share this with somebody if you think they could benefit from it. So anyways, hope you're learn something, and keep your mouth clean. So have a good day.